So Jenny, what moved you to become a registered nurse?
I decided to become a registered nurse so that I could help people, and that's my real passion. My calling from God is to be able to help Americans.
So when you got out of school and became a registered nurse, what was the reality of your situation?
Well, I realized when I was working in the hospital that all I was doing was pushing drugs for the pharmaceutical companies, and that was pretty much what took up most of my time, just focusing on that. I realized that a lot of people were still dying and a lot of people were still sick. Nothing was getting solved, and we weren't getting to the cause of their problems.
So Jenny, do you have any particular examples of situations where you felt like total care wasn't being given, or...
Well, one thing that really stands out in my mind is the way that they treat diabetics in the hospital. So somebody with type 2 diabetes would come in, and they normally take oral medications, not insulin. They would be feeding them sugary foods that are full of fat. So these foods are actually blocking the cells from receiving the insulin. The insulin is spiking, and they would be putting them on insulin in the hospital when they wouldn't even normally be prescribed insulin. So I saw a lot of diabetics whose sugar would bottom out. They would start going into diabetic comas, and they would basically just be taking insulin in the hospital when they normally wouldn't.
Okay, so what can you tell me about your time working in the cardiac wing of the hospital?
So when I was working on the cardiac floor in the hospital, they actually expected me to have 7 acutely ill patients by myself without any physician on the floor, without any nursing assistance whatsoever. And these 7 patients were in different rooms in the hospital. So let's say, for instance, I had one patient in one room that had acute shortness of breath, and then another patient in another room that had chest pain, and another patient that was coming in post-surgery. I was expected to have to be in all 3 rooms, and there's something really wrong with this system to expect one person to be able to do that with 7 people.
So are there any particularly shocking events that happened at your time in the hospital?
Well, there was this one man that I remember in particular, and it legally wasn't his choice to be there at the hospital. He was demented. So the person that was in control of his power of attorney decided that it was in his best interest to be there at the hospital. So this man was strapped down to a bed. He had tubes coming out of his body from everywhere. Basically, he didn't want us to administer medications, but it was my legal responsibility as a nurse to administer medications to him in a stomach that went directly into his, in a tube that went directly into his stomach.
So when you were a nurse, in what ways did you notice the pharmaceutical companies influencing doctors?
Before I started working in the hospital, I worked as a medical assistant for a group of physicians in the area that I'm from. And a lot of times, it was very frequently, sometimes even every single day of the week, these pharmaceutical companies or pharmaceutical reps would come in, and they would bring us these fancy lunches where they would be trying to do trainings on the pharmaceutical company, on the pharmaceuticals, based on their own research. It wasn't even the full research that could have been happening, but yeah, that's definitely a big waste of money. It was like thousands of dollars every week sometimes that they would be spending on trying to educate these doctors about what drugs are the best way to help these people.
So you've obviously seen the darker side of the medical system. In your opinion, in what ways can that be improved upon?
There's definitely a lot of things that need to be improved upon, but I would say the number one thing is what's going to help to improve the health of Americans is a diet change and a lifestyle change. And education is key. Making sure that people understand exactly what they're putting in their body and what to avoid is definitely going to help to improve the health of Americans.
Since your departure from nursing, what have you been doing?
Well, I decided to completely leave conventional medicine, which was one of the best things I could do. I'm working at a holistic chiropractor's office as an office manager now, and one of our main focuses is not only chiropractic care but also education. So we really truly reach out to the community and we educate people as much as possible about what's going into their food, what's going into their medicine, and we have an answer, and it feels really good. It's what I went into nursing for, is to actually be able to help people.